Reducing medication errors is a global challenge, but the good news is that there are increasingly new and innovative ways companies are looking to find solutions to error reduction. You're listening to a special focus on the future of medicine on ReachMD XM160, the channel for medical professionals. I'm Bruce Japsen, the healthcare reporter with the Chicago Tribune, and with me today is Gary Conkright. He's the Chief Executive Officer of Informed. Informed is a company based in Peoria, Illinois, focused on medication safety and is developing, patenting, and commercializing new products specifically focused in the medication error solution space. Mr. Conkright comes from a wide range of experience in technical business startups, venture financing, and technical sales development. He has served as CEO of Smart Signal, where he was recruited by the University of Chicago to develop a business model and plan to commercialize cutting-edge technology developed at the Argonne National Laboratory. He holds a Bachelor of Science degree in Aeronautical Engineering from Purdue University and an MBA from the University of Chicago Graduate School of Business. He is also the holder of 4 U.S. patents. Gary Conkright, welcome to ReachMD XM160, the channel for medical professionals.
Thank you, Bruce. Thanks for having us today.
Tell us a little bit about your company, Informed, this new tool they have for the bedside nurse.
Informed is a medication safety company which was brought to market this past February, a product designed by nurses for nurses to assist in the safe administration of medication at the bedside and to reduce the risk of medication errors. Hardly a week goes by now without reading in the newspaper or seeing on the TV of a medication error that's either harmed or sometimes killed a patient in a hospital. This should not be surprising because the Institute of Medicine has been reporting for several years now that more than 1.5 million people in U.S. hospitals are subjected to a preventable adverse drug event, or a PADE, annually. These errors have led up to an estimated 7,000 deaths per year. Further, the cost of these errors to the U.S. healthcare system has been estimated to exceed $3.5 billion. Additionally, the ASHP, the Professional Organization for Pharmacists in the U.S., has completed a survey where the number one concern for patients entering hospitals is the fear of being subjected to a medication error. Now, since the Institute of Medicine first reported on the prevalence of these types of errors in 1999 in their report called To Err is Human, hospitals have done a lot to bring technologies into their facilities to reduce medication errors. These technologies range from smart IV pumps to computerized physician order entry systems, electronic medical administration records, and bedside barcoding. And all these technologies, when they are lumped together, are effectively building a wall of safety to prevent an error from reaching the patient and harming them. They've done great things. They're very effective in certain areas. However, there's a hole in that wall, and that's the hole that Informed has developed a product to serve. The hole exists because there are times when there's just not time for a medication order to go through the normal pharmacy system, get checked by the pharmacist, have the volume calculated and dispensed in a unit dose by the pharmacist and delivered to the bedside nurse.
And this would be in like an emergency situation or something.
Exactly. Any critical care setting where the patient is deteriorating rapidly and there's just not time to go through that process, the nurse has to do what the pharmacist normally does down in the basement of the hospital. She has to go find a vial of medication in which to draw the order from. She has to do some calculations to figure out how much volume to administer.
Walk us through that and tell us how it works. It'd be great.
Sure. Well, a physician might order at the bedside 10 micrograms per kilogram of epinephrine in a stat situation. The pediatric patient weighs 11.4 kilograms, and the nurse goes and finds a vial of epinephrine, and it's 0.1 milligram per milliliter. Now, the order was given in micrograms, the concentration's in milligrams, and the patient's weight has to be factored into that as well. So she has to set up an algebraic equation and do some math to determine that 1.14 milliliters has to be administered to provide that order. And that's great, but what happens when either the nurse mishears the physician or the physician misspeaks, or what happens if the nurse puts in the wrong decimal point? In the industry, they call this death by decimal point. In either case, the patient can receive an overdose or an underdose of medication in a situation where they can ill afford to have that error.
And you can really see how that can happen because, let's face it, everybody's terrified of math. And if you have a situation where converting micrograms to milligrams, all that stuff, it would be very complicated. So what does your device do to prove the situation?
Our device is a tool that is used by the nurse at the bedside and has a very easy-to-use interface where the nurse can enter the order exactly as it's provided by the physician.
And she does this by a Palm Pilot or something, or?
It's a handheld device that looks like a Palm Pilot, yes. And as the data is put in, there's a lot of human factors work that's been done to identify potential errors and call that to her attention. And once the order is put in, it's compared against a safe range. Now, much like a smart IV pump that we all know about has range checking, our device has similar range checking. It's configured by the pharmacist of the hospital, so it matches the protocol that the hospital has decided is appropriate for that patient class. So, for instance, an order for an emergency room pediatric patient may be very different than the range for a pediatric patient in the ICU. So the range is checked, and then all the math is done automatically. And what the nurse gets then is the volume that she has to administer for the concentration that she has on hand. We really ask our nurses in hospitals to do sometimes the impossible. And in situations where stress is high and the time is short for administering a drug, the nurse has to really fundamentally do three things. She has to calculate the volume of medication she needs to administer per the physician's order. She needs to validate that that order is in fact safe. And thirdly, she has to have certain administration information in order to appropriately and safely sometimes administer that drug. It may be how fast the drug can be administered or what the reversal agent should be if there's an adverse reaction. Our product provides all three of those functions, and not just for infusions as a smart IV pump would, but it does a smart IV pump work as well as injectables and oral suspensions.
The product, by the way, is named Pack 2. Is it getting traction in the marketplace? Because I know you're a new company just coming on the scene. And where might physicians run into this?
We did launch the product in February with our launch customer, Children's Hospital of Illinois in Peoria. And we've attended several trade shows, have several pilots in place as we speak, and hope to announce quite soon some additional hospitals which are implementing our product.
What is the incentive to new product? I mean, a lot of times the healthcare system is, let's face it, they can be a little resistant to technology and they have budget crunches coming ahead with the economy. What is this product going to do and why would they need this?
I think the first driver for the adoption of this technology will be the nurses themselves. We really do have a situation where nurses are left out there to fend for themselves without a safety net or many times without any tools. What we have found is that nurses love this product. It gives them a sense of security that they are not going to harm their patients. Secondly, a lot of the technologies I mentioned earlier are very expensive and costly and time-consuming to implement. Our product is designed as a standalone system. We can get it up and running in a hospital in about 3 or 4 weeks. So the immediate impact on patient safety is pretty phenomenal. And I think all hospitals in this day and age are looking to improve quality of care and reduce cost, and we believe our product delivers on both.
And also, Informed is a company that is trying to develop other products. What can we see down the line with Informed? Because as you have been talking to us about, this one specifically helps nurses prevent the wrong dose errors at the point of care at a patient's bedside. Is there anything else that we can see from Informed down the line?
As you might know, our product was conceived by a neonatal nurse. Necessity is the mother of invention often. And we find that still to be true today. After we introduced our product into the market and had several months of use, we got several suggestions from the nurses that were using the product and have recently introduced version 2.1 of our product, which adds many of these features, makes it easier to use, and provides additional information at the bedside for nurses to use on a daily basis.
Well, that's very interesting because a lot of people think that the physician is often the targeted audience for marketing and developing products. So tell us a little bit about how this did come to pass, because let's face it, there are tens of thousands of nurses out there who might be looking to assist in reducing medication errors, and how this product came about.
Just about every nurse I've spoken to, when you mention the risk of medication error by doing the math at the bedside or mishearing the order, they cringe. They realize that every day they go to work and there's an opportunity for that type of event. So Our founder, who was a practicing neonatal nurse in the Chicago area, saw the opportunity to provide nurses with a tool that could give them the peace of mind and assist them in their daily function, and use technology to do that. As you mentioned a minute ago, we all sometimes are fearful of math. One of the top reasons nursing students don't make it out of nursing school is the inability to pass the math competency exam. And when you think about it, what we want our nurses to do in the field is use their compassionate care and instincts to help patients get better and to report their conditions to their physicians, not necessarily do math and be worried about transposing a decimal point or dividing when they should be adding.
And are these things that can be changed and adapted when you market your product and you go out for ideas? Do you consult with physicians and nurses?
We have several constituencies that we address. Nursing is clearly the foremost in our thoughts of how we can deliver tools that will help them. But pharmacists are also key players in this equation. In fact, we market our product as extending the reach of the pharmacist. Pharmacy knows pretty well exactly what happens to medications when they go through the traditional pharmacy system. But when there's an emergent care situation and nurses are doing the work of pharmacists, pharmacists really do not have visibility to the degree they would like, or the ability to effect those administrations to the degree they should. And so this product kind of links the pharmacist to the nurse in a way that works within the workflow of both. We also work very closely with patient safety people. They are concerned not only with improving quality, but reducing the cost to the healthcare system, which is pretty significant, as I mentioned before.
Well, with that, I'd like to thank Gary Conkright, who's been our guest. He's the Chief Executive Officer of Informed, which is a medication safety company focused on developing, patenting, and commercializing new products in the medication error solution space. And you will be hearing more about this company to come. My name's Bruce Japsen. I've been your host. I'm with the Chicago Tribune, and you've been listening to ReachMD XM 160, the channel for medical professionals. Please visit our website at reachmd.com, which features our entire library through on-demand podcasts, or you can also call us toll-free with your comments and suggestions at 888-639-6157. That is 888-639-6157. And I'd like to thank you today for listening.